introduction, Patty Nantel serves as the Director of Quality and Professional Practice for Nursing and Patient Care Operations at Boston Children's Hospital. There she's been involved in numerous quality improvement initiatives, past and present, and has been CPHQ certified since 2013. And she is certified as a Lean Six Sigma Green Belt. In addition to her primary role at Children's, she also helps coach staff as they complete their Green Belt projects for certification. So without further ado, I'd like to welcome Patty.
Can you hear me now?
Yeah.
Okay, great.
Great.
All right, thank you, Haley. As Haley mentioned, I do work at Children's Hospital, which is a 404-bed comprehensive center for pediatric health care. In 2012, Howard Brightman, with the support of Lorraine Daniels, a Lean Six Sigma Black Belt consultant, brought Lean Six Sigma methodology to BCH. Together they developed a white belt and a yellow belt introductory class, which they built on each other. Some staff, attend the white and stop there. Some staff go on to yellow belt, and a more select group goes on to a green belt with the goal of leading and completing a process improvement project. Since the start of these classes, hundreds of staff in all different roles and from many different areas of the hospital have attended. I was an early recipient of this training and have benefited greatly from learning this process improvement methodology. I've used what I've learned in my Greenbelt training in my previous role as a nurse manager, and I currently use it now as the quality director for nursing. Overall, we've found that there's great value in an organization having a consistent framework for conducting their improvement initiatives. Although Lean Six Sigma is not the only process improvement methodology out there, it's one that has worked for us. It's very helpful to have a common language for staff as they talk about process improvement. Some of the projects I'm going to share today come from staff that were on my old unit that I manage, and these staff had attended the trainings. Of note, this training is being offered for people outside of BCH as well. So, to go on to the goals of this webinar, as you know, it takes time to complete a Lean Six Sigma training. As you can see, the white belt and yellow belt were one-day classes, and the Lean Six Sigma green belt training was a week-long and had other things involved in it. So obviously I will not be able to cover everything in our allotted time today. What I am going to do is focus on high-level principles and share the use of these principles through example projects that I've been involved with. I also will be sharing helpful tools that I've learned in my Lean Six Sigma training and have used in process improvement projects in the past. The goal for today is to review some of these Lean Six Sigma principles, give examples of Lean Six Sigma tools and how they're used in projects, and lastly, discuss some ways to manage change, which is such a large part of the process improvement. Next slide. So to start with a little history, I want to begin with a little bit of history, but not going totally back. I'm going to start more in the 80s. Lean Six Sigma was built on TQM, Total Quality Management, which was an effort undertaken by the Navy in the 1980s. This was somewhat in response to what was going on in Japan with Toyota and the lean process improvement methodology that they were having in place there with good success. The key concepts of total quality management were: quality is defined by customers' requirements, top management has direct responsibility for quality improvement, increased quality comes from systematic analysis and improvement of work processes, and finally, quality improvement is a continuous effort and conducted throughout the organization. All these concepts are basic, are very embedded in Lean Six Sigma as well. So manufacturing companies here in the U.S., Motorola being the most notable, was one of the first companies to build their own process improvement methodologies. And Motorola certified its first black belt Six Sigma expert in the early 90s. Since then, this methodology has spread to many other industries with the heavy emphasis of viewing things from the customer's perspective. I know there are some people who feel like it is, because it was so heavily used in manufacturing, that it doesn't work as well in healthcare. I hope by the end of this presentation that you would agree with me that it does have its place here. In short, the Lean Six Sigma methodology relies on a collaborative team effort to improve performance by systematically removing waste, reducing variation, and improving flow. I will be saying removing waste, reducing variation, and improving flow throughout this rest of this talk, because that is some of the key principles for Lean Six Sigma. So you could not have a talk on Lean Six Sigma without talking about the DMAIC. The DMAIC stands for define. Why is your process important, or that you want to improve important? Measure, how is the process doing? Analyze, what's wrong with the process? Improve, what are your interventions? And control, how are we going to maintain it after we intervene? So before I learned this methodology, too many of my problem-solving decisions were based on gut feeling, and I was generally unsuccessful at driving change within a clinical area or across multiple clinical areas. I'd be very quick to jump to interventions without spending time on defining the issues. I now, after my training, take the time to define what the problem is and look for things that I can measure before starting any interventions. Learning this methodology and applying the principles and tools have worked for big and small quality improvement projects. We don't have time to work through all the aspects of the DMAIC, so for the rest of this presentation, I will describe examples of projects that focused on the principles embedded in this methodology for removing waste, reducing variation, and improving flow to improve performance. I'll also weave in the use of some simple tools that help inform the process. So, identifying waste. You can't talk about lean without talking about waste. There are 8, as you can see here on the screen, there are 8 types of waste identified. Defects that are errors in work, overproduction, a supplying process with more than is needed, waiting for things to be processed, or waiting for people, or people waiting for things. Non-utilization of human talent. That's an interesting one. Not having the right people involved in the process. We all can relate to waste in meetings when the right people are not in the room. Mm-hmm. Transportation, unnecessary movement of products. Inventory, having excess work in process. Motion, unnecessary movement of people. And over-processing. We tolerate, or I have tolerated, a lot of waste in my work life. Examples: walking into a cluttered clean supply closet and trying to find what I was looking for, spending a lot of time, and sometimes not finding it. There have been a lot of examples of patients waiting for an appointment, waiting for someone to answer their call light. Staff also wait for medications, wait for equipment. And there are plenty of defects. It could be a canceled lab, or a number of things can go wrong in our busy environment. And then there could be motion waste, rounds that take too long and are inefficient. My Six Sigma training helped me and those that took the training, helped me and those who took the training to be more sensitive and aware of waste as a problem that could be solved rather than just tolerated. So the first example I'm going to use is bedside equipment, a project called Bedside Equipment. This bedside equipment project is an example of staff members identifying waste and creating a plan to decrease it. This type of waste falls into the inventory category. The problem is that there was so much clutter at the bedside that it took time and energy to find what the person needed. And once they got through the mess, they may have not found what they wanted, and then it took time to go look for it somewhere else. I am getting a message, just if I can stop for a minute, that says you may have to turn the volume up on your phone if you haven't already. So I'm going to do that. Okay, hopefully that's better. Okay, so back to the bedside equipment project. So as I said, this project happened on a unit that I managed. A few staff members became sensitive to the waste at the bedside due to the clutter and disorganization. They raised this as an issue to leadership on the unit, who immediately thought of a tool that they had heard about in their white belt training. And that tool was 5S. So 5S is a very helpful tool. The 5S stands for sort, straighten, shine, standardize, and sustain. This is the English version, as originally these were 5 Japanese words that started with S, but the concept is the same. 5S can be used in a number of areas. The example that is often used to explain 5S, and I wish I had a picture here, but I'm sure you can picture it in your head, is a set of tools on a pegboard. You can picture the tools hanging on the pegboard all sorted and straightened, but the sustain piece comes in by having the tools outlined on that pegboard. So once the tool is used and it can be put back in place and be easily found. You can use 5S at home, at work, on your desk, and I have grand plans, even though I have yet to do it, to 5S my email inbox and folders, understanding and knowing how much time I waste looking for old emails. Places in the hospital that 5S has been used is clean supply rooms, outlining on the floor with tape where certain pieces of equipment should go, or having pictures of that equipment on the wall showing where it should go. For example, computer on wheels can have their own designated place, hopefully by an outlet, so that staff aren't taking the time to look for them. So here's the result of the 5S project. The leaders of this project provided staff with educational materials on the 5S concept, posted signs in each room detailing expectations. They even created a short video. Medication drawers were organized with 6 paper trays, and the bedside computer or table was organized with pink buckets for patient supplies. Emergency equipment was standardized in each room, and although it does take a subset of staff to continue to champion this project, staff quickly realized the benefit and they were on board. This is an example of identifying waste and decreasing variation. The next project I want to share we'll call Timeliness of Antibiotic Administration. This is about the waste in waiting, which leads to the principle of improving flow. Flow is very important to any process. As you can see in the picture above of the people in the canoe, flow can be disrupted by barriers. In our process improvement work, we need to identify these barriers so that flow can then be improved. The problem identified in this project was that there was room for improvement regarding the administration of antibiotics within 1 hour for patients with suspected or probable sepsis, and that 1 hour is the standard. This project was done on 3 medical units by a staff member who was getting their green belt. Some of the tools used in this project were helpful in the defining phase of the project. Some of the tools used in this project came from the defining phase, where and it's the top-down process chart and the waste walk. So the top-down process chart. This top-down process map helps to create a simple picture of the process using 2 levels of detail. It is helpful to have everyone on the team have a common understanding of the process and be in agreement regarding the steps. When creating this top-down, the team needs to agree on the starting point and the end point, and then identify the major steps and list the sub-steps. This is a simplified process map, unlike those more detailed process maps that you are probably used to seeing that have arrows and rectangles for activities and diamonds for decision points. This type of process map does not show these decision points or feedback loops, but I find it helpful to identify the steps, and it can help highlight waste in the system. You can take this process map and continue and make a more complicated or detailed process map later, if that helps. So an example of the top-down in the antibiotic project shows that they identified the major steps of the nurse recognizing the potential for sepsis, the prescriber getting the order written, the pharmacy processing and dispensing, delivering the medication, and the nurse administering the medication. What's interesting is what happens is there's often assumptions by the team as to where the waste is. And in this particular project, there was an assumption that the waste was in the dispensing. So to further investigate this, the leader of this project went to the Gemba. So going to the Gemba. Gemba comes from a Japanese word for the place where the work happens. I can't tell you how helpful it is to see the process in person. It helps to eliminate many of the assumptions that can be made about any process. And one of the main reasons for going to the Gemba is to look for waste. I was once working on a project to decrease complaints from families trying to book appointments. It was eye-opening for me to go sit with staff that were taking the calls, and I learned so much about the process from just that time being there that I never would have understood any other way. So back to the antibiotic project. Regarding this assumption that the issue was particularly in the delivery, well, not necessarily the dispensing, but the delivery process, a member of the team followed the tech that delivered medications from the pharmacy to different units to see how long it took. It obviously had a stopwatch and used seconds. 16 separate trips happened with an average time of 2.5 minutes, which it then became clear to the group that the delivery from the pharmacy really wasn't the cause of the delay for the antibiotics. Based on this and more input, what was decided or what was discovered was a major part of the delay was that antibiotics weren't being ordered stat, which then delayed dispensing. So work was done to improve this part of the process, and as you can see from the results above, that within 3 months they were able to decrease the time to a mean of 50 minutes, time to administer from order, and increase antibiotics for probable sepsis by that were ordered stat to 70%. Okay, so last project I want to talk about is lab specimen cancellation. This type of waste would be in the defects category. Although overall our rate of cancellation is fairly low when you consider all the labs that are taken, it's clear that waste happens. And it's not only a waste of time for lab staff and clinical staff whenever a lab has to be canceled. It's also potentially a painful redraw for the patient and causes distress. So we want to be able to improve this as much as possible. The tools that this project's ongoing, I'm currently using in this project are the fishbone, cause and effect, or commonly called the cause and effect diagram, and visual management. Before I get to those tools, I want to take a moment to talk about the importance of data. Again, the rate was overall small for canceled labs, but in order to focus our attention on what to work on specifically, we had to see the defects, the actual defects and what types they were. So as you can see from this graph, 50%, over 50% of the time, a sample was canceled due to it being clotted. The next highest was quantity non-sufficient, and the third was that the specimen was hemolyzed. Together, that was 86% of the overall reason for specimens being canceled. So this was very helpful for us to see what we could potentially impact to decrease the overall rate of canceled labs. This kind of data is very important when in making decisions and identifying scope of your project. So what we did after getting our data is we did a brainstorming exercise, and that's the fishbone or cause and effect diagram. This really helps to get to the reasons why the defects happen. And I believe that you've already had a webinar on this, but I can't emphasize this tool enough. I think it is so helpful in getting to underlying causes. It's important to get the right people in the room that are involved in all aspects of the process that you're unpacking. You start by asking questions. The categories are there to help people think through reasons other than people, think through environment, potentially it's policy, could be, you know, materials, whatever. And it's very helpful to ask the 5 whys. You may not get to 5, but just to ask 1 or 2 or 3 helps get to the root of the issue rather than just the symptom. So in doing the cause and effect diagram for this project, it became clear to us that staff, not phlebotomy staff, but nursing staff, had a lack of knowledge about how many times one should invert the tube to prevent clotting and how important the fill volume in order to draw was for the integrity of the sample. So what did we do? This is where the visual management came in. This led to a creation of reminders, which we more formally call visual management. A staff member on the team for this project made up this card, best to remember green than purple, hoping that would help people remember the B, R, G, and P for purple or pink would help you with the order. And then there was a reminder about how many inversions for each one of those types of tubes. And she posted these cards on the computers that were in the room or near the room for the patients. We are still in the midst of working on this project, so we haven't yet. I don't have measurement for you to show the impact, but I am optimistic. So now we're going to talk about managing change. For any QI project, one ultimately improves a process by making changes. The people impacted will have to stop doing things the old way and start doing things the new way. This does not happen naturally, I think, as we all know. Hence the equation Q times A equals E. This came out of a GE program called Change Acceleration Process. And what that equation is saying is you can have a great quality project, but if there's no acceptance, you will not be effective. And as we all know, if there's zero acceptance, you'll have zero effectiveness. Hopefully there'll always be a little bit more than zero. But I think that's a good reminder of how important it is to focus on the people and the change that they're going through. And I think Six Sigma taught me a lot about this in all aspects of the DMAIC. It always is putting people first, and it's showing how we can inform them about what we're doing in the process improvement. So what can be done to facilitate acceptance? These are some of the things that I've learned over the course of informally or formally coaching projects. and it is very consistent with all Lean Six Sigma principles. So taking the time to define the problem from the customer's perspective. You can do this a number of ways. It's just so important to get the customer's perspective. So make sure that you have the right members on the team when you put together the team, and get the customer's voice beyond the team. So to clarify who the customer is, the definition of customer is any person or group that receives the output of the process. So involving more people I've also found that involving more people helps to increase the value of the project as they begin to see why it's a problem and needs to be fixed. So that, as you all know, people on the team will talk to other people, so it just helps to spread it. So that's the first thing I wanted to talk about. The second thing is involving the stakeholders. I have had projects derailed because I did not do this. So the stakeholders are one of the major stakeholders is leadership. You need to develop a communication plan with leadership. They don't have to be at all the meetings, but they should be involved on some level. You want to ensure buy-in from the top. So it could be a plan to email them once a week. It could be a plan to meet with your leaders once a month, just so that they are aware of what's going on. Next, engaging the front line in the process improvement. The cause and effect analysis is a good place to start, but any way you can think to get more people involved in what's going on helps to make the project go more smoothly in terms of acceptance. Another point is quick wins. If you find quick wins, and you can find them all along the project, usually something comes up that you say, oh, we could take care of that, and we could take care of that tomorrow or next week. A quick win is something that is easy to implement, requires little coordination and planning. In the case of the timeliness to antibiotic project, they realized that the order set did not include an option for IM. In the case there was no IV access. This was not hard to add, and we considered that a quick win. Another example of a quick win was a project that I was on to improve the timeliness of rounds, or the efficiency of rounds. One of the identified issues that could slow rounds down were finding rolling computers and finding that they were not charged. As many of them weren't plugged in and had lost that charge. The quick win was assigning one of the evening administrative staff to make sure that all computers were in a designated space at the end of the day and that they were plugged in. Simple but effective, and it had an immediate impact on lowering the frustration level the next day. And it helps people get energized about the project. Another way to involve staff is by providing feedback on what's going on with the process through the use of data. I find this to be incredibly helpful, and whenever we can, this does get to a whole nother talk about how to use data and how to make it readable for staff. Not what I'm going into, but just having the data in a format that they can understand and see how things are going, and have it posted on your unit. And we can get, for the specimen collection, we can get unit level data on their rate of cancer labs and the different types, and that's good information for them. For the antibiotic project, they were able to see that the time that it was taking on a monthly basis to administer IV antibiotics, and encouraged when they see that time going down. And for those that are competitive, it can help drive change. So those are just some ways that I have found that that I can boost acceptance for any project, and I hope that that's helpful for you as well. So I hope that this has been a helpful introduction to Lean Six Sigma. And I hope that you have a greater understanding of how to improve performance by systematically removing waste, reducing variation, and improving flow, and most importantly, viewing things from the customer's perspective. Now is time for questions. Participants can use *7 on their phone to unmute to ask a question, and then you can use *6 to mute before when your question has been answered. Any questions?
Patty, this is Lynn Myers. Thank you so much. That was really excellent. I love the equation Q times A equals E. I've never seen that before. That's beautiful. I do want to back up, though, for my question. When you talked about teams being too quick to jump to interventions, I'm sure that's an experience that all of us have had. Can you talk a little bit about how you reel the team in and get them to analyze the process and the problem before they jump to interventions?
How it happens is, whenever it's a Six Sigma project, we start off by defining or going through the DMAIC, and we talk to them about how the defining phase is going to take a long time, and that we need to do our homework. I mean, it starts, and this is one of the things I also didn't talk about, it starts with creating your charter, which is your goal, and it starts with a huge discussion about what our scope is, and then it goes, it's more, I think, as I mentioned, you want to be able to see what you can measure, so it's finding out the aspects that you can measure, and then I would say I pretty much, once we've identified what is the problem we want to fix, then we start doing our brainstorming activities by going to staff and doing the cause and effect analysis. I hope that answers your question.
That's great. I think that the point about setting expectations up front
yes.
can help the team move through the process in a stepwise fashion. Thank you so much.
Yes, and then you still have to police that, because I can tell you many a time you say, oh, well, that's an intervention, we're going to hold off on that now. Because it is all of our inclination to do that.
Thank you very much.
Anybody else?
Hi, Patty. This is Haley.
Hi, Haley.
So I've also been in many a project where frontline staff, or not frontline staff, the leadership has not been involved early enough and then brought to leadership too late, and it hasn't panned out the same way, and kind of barriers have been set up. So how do you approach engaging leadership early on, and how do you present it to them in a way that kind of shows them the value of the project?
I think two different really answers to this. Sometimes you have an informal project, and then you know who the leaders are that you have to go and meet with. But in a more formal project, I would hope that there would be a sponsor identified. And once the sponsor is identified, then you have the permission to set up, ask them how do you want to be communicated with. And then ask them to be at the first meeting where you do your kickoff, and then based on the plan, the communication plan, you keep them in the loop. But it's identifying the people who you think, the leaders that can really help push this project forward. Once you've identified them, then figuring out how you're going to communicate with them. And like I said, it could be just a telephone call or a meeting. I think they want to be involved in the process and know.
Great. Thank you.
Has anybody on the line had a Six Sigma training, and do they want to share what they learned?
Hi, can you hear me okay?
Yeah.
Hi, my name is Travis from Monadnock Community Hospital, and I have been a black belt for about a year and a green belt for 3 or 4. And I think our journey here at the hospital has focused a lot on making it functional. I think a lot of people get lost in the mathematics or the intricacies of the different tools, and I think that the thing that I've really identified as valuable from a Lean Six Sigma perspective is that there's really no wrong way to use a tool. And so we have monthly Lean check-in meetings with all of our department managers, and they're encouraged to bring staff, and a lot of times we'll use that time to educate folks on a tool, and it could include some of the ones that you covered today. We've done SIPOCs, we've even done control charts, and introduce people to how do you create and use basic control charts and things like that. And I think where we've seen our success has been sort of helping staff to realize that it's really easy to do some of this stuff if you have the templates available and you just kind of break it down to basics. And that's where we see people really get engaged and take advantage of the tools that are available.
Thank you so much. That's has been my experience as well, and I really appreciate that, because I have found I sort of worry that I because sometimes I don't work through the whole process. I just use what works, and I think it's helpful to hear that other people are finding that as well. Anyone else?